from Upsurgeon company. She will talk about, please, dear Miss Ria. She will speak about a new horizon of education and how to change our mind about possibility to be better, not just in cadaver lab or in live surgery room, but she will be speaking about some another way to be better and to improve your skills. Thank you so much.
One thing Dr. Yuri said, that how to make you better. There are different ways to make you better. It's not that we are going to make you better as part of Upsurgeon, but we are showing you another way, a possibility to transfer your skills to the young generation. That's all I want to say. What is Upsurgeon? They can't see? Is it possible to, okay, we are here. Awesome. What is Upsurgeon? Why am I here? I'm not a neurosurgeon. I'm representing a company run by a group of neurosurgeons. They came together and they thought, what's the best way to train more and more in your life? You do cadaver trainings, you do live patient trainings, but how many times do you do this? 1 time, 2 times, but is that enough? This is what we thought. We thought that this is not enough. We should find something to give you a chance to transfer your skills to the young generation. And that's why we were born 7 years ago. And we named it Upsurgeon, to elevate the skills of a surgeon. Why are we here and what is our mission? Our mission is to bring the certification style of aviation into surgery. When pilots become a pilot, what do? They use simulator training. They sit on simulators, they do n number of flying, and then they go to the real plane. It's this style we want to bring into surgery. Imagine if you were going to a surgery and then some complication happens, and that's not cool, right? It's at the risk of the patient. So this is why we thought that we should bring a different kind of training into this world, and that is Upsurgeon. The definition of training, what we all know, is that we can train only on cadavers and on live tissue. But it's not like that anymore. The medical technologies that you see here as implants and all are from the 21st century. But the training that you do is still of the 19th century, is what we think. And because of that, people need to go several times under surgery, and there are a lot of complications. Some people lose their lives as well. And there's a percentage of malpractice because people train on live patients. We did some papers. We are supported by the group of surgeons across the world, wherein they did papers saying that when you do a motor skill training, it is not always the same. Whenever you do training, it is very good. When you stop training and come back to do a training, it is not the same. So you see the graph is not always good. However, when you use a simulator, and this is a paper being published, when you use a simulation and you do learning on the simulation, the curve is always constant. And this is why we think that simulated training should be a part of a lifestyle. It should be a part of how you practice. We have another paper which supports that there are a lot of disciplines which are very risky. For example, have a look at this. A young neurosurgeon trying to do an aneurysm clipping, and he has not done his training many times. He has done 1 time or 2 times. What happens? The aneurysm ruptures. What can he do? That's very dangerous. And this is why. Can he say that, oh, I made a mistake, I will try again? Can he try again? No, he cannot. It's same like the pilot is flying a plane for the first time. And if it crashes, can the pilot say, I'll try again? But no, it comes as a cost. So this is why we were born. We were born in 2020. We started this organization, and we have a little video here which shows what we have done so far.
This is a real revolution in training that open up new horizons.
I really feel like the residents and fellows and medical students all get so much more out of using this system.
I was very impressed, actually. A lot of the learners were very impressed with the amount of detail with the anatomy.
The virtual reality and the app is very tremendous for the residents. It's something that they can go back to, and we thought was very useful.
Just reinforces the anatomy and surgical approaches in 3 ways, in 3 times repetition, which really just reinforces the concepts of the structural anatomy and the approaches for the students in a way that I've never seen before.
Brain boxes are changing the way education works.
I had the wonderful opportunity of talking to some of its key team members and their vision, and I've been truly left with a great sense of hope and inspiration for what they're trying to do.
And I think this is an amazing way for residents to get hands-on experience and devote a lot more hours to this than they would normally be able to.
This will be very interesting also in lower developed country where the possibility to reach a lab which is so simple, so you can put it in a box without requiring the setting that cadaver lab will need is very interesting.
Education is now possible anytime, anywhere, and also for everybody.
I hope this video showed something. This showed the people across the world telling that they finally got something on a table, on a desk, something to keep practicing their skills again and again so that they feel confident when they go to a cadaver training or when they go to a live patient. What we do at Upsurgeon, we don't just make boxes. We give you a 3-dimensional training. We have the metaverse. For example, you want to do an ACDF procedure or a lumbar surgery. We make you imagine a virtual room. So you put the glasses, you understand how the training should be done. Then you go to physical training, which you do it on the box. And finally, you complete the training by keeping the box in front of you and by putting the glasses. This way, you have understood the entire training in 3 steps. This is what we have done so far. We have literature, which is very important for us. We have been backed up by scientific team across the globe. We have done papers, we have patents, and we are a team of 70 people. We do global training programs in different parts of the world where we are needed. These are some pictures. We have a very important paper from the Harvard School, wherein they did a paper with our aneurysm box. So this was the first paper, wherein they were applying some metrics to how repeated training on a simulator could have the skills much steeper. This is our aneurysm box, where you can learn how to do a clipping. There's another paper. It's an ongoing study with Stanford University. And what you see here it's an ACDF procedure being done in the hallway of the Stanford University. So they didn't have a space, they don't have a specific space. They bought the microscope to the hallway, and they started doing an ACGF procedure. It's as simple as that. How we do this is very important. We have the seven-step methodology. What we do is we are backed up with a scientific team, which is our CEO, who's a neurosurgeon. He and the scientific team sit together and give us the idea of the anatomy. Then this anatomy is transformed with the help of the tissues archive that we have. So we know how the tissues are made, we get the anatomy help from our CEO, and we put it together, and we create our models. Our models are present in neurosurgery, ENT, and spine surgery. This is one of the examples of how we are doing the training. We do it anywhere, everywhere across the world. Like Dr. Yuri has it on a table, we also do it in different parts of the world. That's the box, which is very important and which has been loved by everyone across the globe. We understood there was a need of practicing continuously the monoportal and biportal endoscopy, and this is why we bought out the box. We were challenged by neurosurgeons across the world saying, you cannot make it realistic, you cannot make it a cadaver, but we have some pictures. You can see how close we could get to a cadaver training. We say, do more and more of simulator trainings before going to a cadaver training and then doing a live patient. So we are not removing from you the cadaver training. It is very important. We say that cadaver training is very important. But before that, please do your training on a box, and then you move to a cadaver training, and then you move to a live patient. There's another example of our existence in the pediatric neurosurgery. This was another chance given to us where people said we cannot train our children, We don't have children's cadavers. What do? We said, we can make it for you, and we bought this. We got 50 surgeons together in a room. They transferred their knowledge, how to do a craniosynostosis. They bought it on the table. Every 2 participants were working on 1 child. And we were very happy that it was successful. We do a lot of pre-congress courses across the globe. We do workshops. This was another example of AANS, where 100 surgeons had 10 stations and they did 100 craniotomies. I know this is not important because it's cranial, but we want to show you that the level of realism that we can achieve with our boxes is this. And you see the number of skulls being used in one particular course. You use a skull, you do your training, and then you just dispose it, and you're ready for your next training. That's it. This is our team. We are a bunch of neurosurgeons. We are a bunch of 3D printing team. And we are very small, but we have a lot of dreams to go big. We are entering into orthopedics. In future, we are going into endovascular. So wherever there's a need, we will be there. Thank you.
Thank you so much. I think it was like a very, very beautiful fairy tale. Thank you so much, because future is not in the future. Future is today, in the present day. And that's why I so thank you for this incredible presentation. And I'm sure that a lot of us have a lot of questions. That's why, okay, I will start from our president.
Dear Ria, thank you very much for your nice presentation. Do you have some products for abdominal surgeons and thoracic? No? Hand surgery? Hand surgery, yes. Yes? Knee, ankle? No. Hand surgery, yes. Okay. And do you think about, you and your team, about cardiac surgery, thoracic surgery, abdominal? No?
Since we started by neurosurgeons and they knew how to do it, maybe in future we have to take help of surgeons to teach us what will be the anatomy. But right now in our pipeline is endovascular and orthopedics. We are into scoliosis. We entered scoliosis with our, and deformity with our Lenke models, but we don't have what you need right
Thank you.
now. Maybe
Thank
next year.
Thank you.
Thank you.
Thank you so much, Dr. Hassan.
Thank you very much. We saw beautiful videos.
Thank you.
I want to ask that those glasses
Yes.
You use, are these for virtual reality or augmented reality?
Virtual reality. It's the Oculus.
So you cannot see inside of the model?
No.
Okay.
We are making like a 3D imaging. Like imagine you're into an OR, and what kind of instruments you should take first, and all these steps are taught.
But you cannot see, when you look at the model's skin, you cannot see inside of the skin.
That is available on our app.
Okay. And,
yeah. The AR.
and what is the brand of these glasses?
Oculus.
Oculus.
Yes.
Okay. Okay. Thank you so much.
Welcome. Anything else?
Thank you.
Anything you think you should ask me? Maybe you don't think this is not the future. Please ask us. I'm ready to get
Alexander,
challenged
I
by
think
you.
you have a question. You were so impressed.
Thank you. Beautiful presentation. my question. From pediatric neurosurgery,
Yes.
now only craniostenosis,
Right now only craniosynostosis. Yeah.
and future?
We don't know.
We don't
We usually don't bring products when people ask us that this is very important, this is what I want to train upon in the country, we then make it for them.
Thank you. Craniostenosis is a big problem.
Yes, it's
Yeah,
a very
thank you.
big problem.
Thank you so much.
Yes,
Thank you.
that's why we created it. Thank you.
Thank you. Who next? No questions?
Okay.
Okay, thank you so much. But I think what you have a lot of time before, that's why thank you so much, my dear. Thanks for your confirmation, the visit here, and I think what we will meet again, a lot of time. And of course, I want to invite you to our next meeting in Chernivtsi city. You were in this city. You have some.
It's actually closer to the border.
Yes, yes.
Faster. That's very important.
Yes, that's why. Thank you, my dear, so much.